This is a 2-month-old child with bilateral congenital cataract. Firstly, I measured the corneal diameter. Horizontal and vertical corneal diameter both were 11 millimeters. As we can see, the morphology of the cataract, it's membranous cataract. I started with doing 2 side ports, injecting intracameral adrenaline and intracameral Treban blue, then injecting viscoelastic. Starting to doing the capsular excess, I realized that the anterior capsule is fibrosed, so I just did a small nick, and then I continued using micro scissors. Then I tried to complete the excess with micro forceps, but again I felt that rhexis might extend because of the fibrous nature of the anterior capsule. So again I used the micro scissors from the other side port and completed the capsular rhexis. After that, I used 20 gauge anterior vitrectomy cutter, firstly in irrigation aspiration mode to aspirate the lens material. After finishing lens aspiration, I used the anterior vitrectomy cutter to do vitrectorhexis to the posterior capsule. So I did a small opening in the posterior capsule and did anterior vitrectomy. Then I enlarged the posterior capsulotomy gradually. Usually in such cases, I aim for 5 to 5.5 millimeter of anterior and posterior capsulotomy. So you can see here the small posterior capsular opening, and I'm trying to enlarge it with the anterior vitrectomy cutter slowly to reach the desired size of the capsular excess. Sometimes also you can use the anterior vitrectomy cutter to enlarge the anterior capsular opening if the initial anterior capsular opening is smaller than 5 millimeters. While doing the posterior capsulotomy, I also do anterior vitrectomy to cut the anterior vitreous. After finishing anterior vitrectomy, I injected large air bubble and I sutured both side ports with 10-0 vicryl sutures and injecting subconjunctival steroids. Thank you.